The topic of my lecture is acute appendicitis. The objectives of my lecture are that by the end of the lecture, the students of final year MBBS will be able to understand the surgical anatomy of appendix and they will be able to give a management plan for the cases of acute appendicitis in 4 out of 5 cases. Now regarding the anatomy of appendix. Appendix arises as a blind outpouching from the lower end of cecum at the site where three tinea coli merge, near the ileocecal junction. The position of appendix is never constant. The commonest position of appendix is retrocecal or 11 o'clock position, which is present in about 74% of cases. In around 22% cases, the position is pelvic or 5 o'clock. The other positions are post-ileal, pre-ileal, or subcecal positions, which are quite rare and are about 1 to 2% in incidence. Now, what is acute appendicitis? Acute appendicitis is acute inflammation of appendix. Its peak incidence occurs in teens and early 20s. Now, what causes appendicitis to occur? Mostly the causes are unknown, but few people say that the appendicitis occurs due to obstruction caused by fecalith tumor or worm infestation. Patients with acute appendicitis present with the symptoms of central abdominal pain that later shifts to the right iliac fossa. This pain may be associated with nausea, vomiting, loss of appetite, and low grade fever as well. May present with constipation or with diarrhea as well, especially if appendix is pelvic in position. Some patients present with abdominal bloating as well. When we examine these patients in hospital, generally they are tachycardic. When we ask them to cough, they complain of pain in right iliac fossa. When we examine them and palpate them in abdomen, they have tenderness in right iliac fossa and rebound tenderness in right iliac fossa as well. When we palpate them in left iliac fossa and we gently lift our hand, they feel pain in right iliac fossa. This is known as a positive Rovsing sign and it shows presence of acute appendicitis. Because as we lift hand in the left iliac fossa, the appendix moves and irritates the peritoneum of the right iliac fossa, thus showing the presence of acute appendicitis. As I've already told you, students, that 74% of the appendix are present in the retrocecal position. The retrocecal appendix lies over the psoas muscle and it shows by irritating the psoas muscle. So, if we are expecting that appendix is irritating the psoas muscle, we can prove it by hyperextending the hip joint. If on hyperextension of hip joint patient experiences pain, then psoas sign is positive and it means that the appendix is retrocecal in position. Similarly, if we are expecting that patient's appendix is in pelvic position, we ask the patient to flex and internally rotate the hip joint. If the pain is increased, then it means that the appendix is in pelvic position and is lying over the obturator internus muscle. And by this maneuver, the obturator internus muscle is irritated and patient's pain is increased. The diagnosis of acute appendicitis is clinical based on history and physical examination. But this diagnosis is consolidated by certain investigations, that is CBC. Here we see that TLC or total leukocyte count is increased. In urinalysis, we rule out the presence of urinary tract infection. We go for ultrasound in females of childbearing age to rule out ectopic pregnancy or ruptured ovarian cyst. CT scan abdomen is done in only those cases when there is diagnostic difficulty. Only in those cases, a focused CT scan for appendix is performed. When a definitive diagnosis of acute appendicitis has been made, then treatment is always surgical. And what surgical treatment is undertaken? That is, appendicectomy is performed. Approach is either open or laparoscopic. For open approach, a small incision is made in the right iliac fossa and open appendicectomy is performed. But for the laparoscopic approach, three small incisions are made in the abdomen through which three ports are inserted, and laparoscopic appendicectomy is done. This laparoscopic appendicectomy is now the gold standard, which is done for the acute appendicitis. If the facilities of laparoscopic surgery are available in the center. So, to summarize my presentation, acute appendicitis is acute inflammation of appendix, and when diagnosed, the treatment is appendicectomy. And appendicectomy is undertaken by open or laparoscopic approaches, and laparoscopic approach is the gold standard treatment of acute appendicitis nowadays. Thank you. Thank you very much.